Rick, thank you for the introduction. Thanks for the opportunity to be here. We're thrilled to be here. So I know we have 10 minutes, so I'm going to hit very high-level overview of Profility and what we do. As Baruch had described, when you think about healthcare anywhere in the world right now, we're in a crisis. And the crisis is really driven by some good news in that we're all living a lot longer. That's the good news. The challenge is we've got to fund the care of patients that are aging. And when you look at the statistics, and the United States sticks out here, 17.5% of the GDP is spent on healthcare today, and it's growing. It's unsustainable. When you think about the areas in the U.S. that are really being affected, the hospitals right now are being fined for early readmissions. Patients, we're pushing them out faster, and they're sicker, so they're coming back. 3/4 of the hospitals in the U.S. were fined for early readmission rates. And then again, if you think about the types of patients that are the most complex, it's the elderly. So today, I want to not only tell you what the issue is, but talk about how Profility's predictive analytic engine and personalized profiles of patients will help us optimize the care for people. You'll see this as we walk through, but here's a quote from the American Medical Association that's talking about the amount of money that could be saved with personalized predictive analytics. These numbers are amazing, but if you think about them fundamentally, over-treatment. We know that when you go to the hospital now, they do every test they can imagine on you to basically not miss something. It doesn't have to do with what you need that's really going to deliver value. The same thing can be said for delivery and coordination of care. Making sure the right patient gets the right treatment at the right time. Sounds simple, but our healthcare environment is very silo-oriented. We're here to help fix that. So when you think about our current healthcare system, I think this is a great visual. You've got 10 people around the outside here, and you've got a person in the middle. So we're not developing care for each one of these individuals. We're basically taking all these individuals and melding them into one average patient. So when you think about care pathways and patients who go in to have a hip replacement, there's a protocol. If you're 75, you're a male, you have hip replacement, these are the things that actually follow suit. We know that there's tremendous inefficiencies in that, and frankly across any of the healthcare plans. So Iridian's approach is quite different. Instead of starting from the top up, we start from the bottom, the patient's actual profile, the specific characteristics of that patient, to be able to build a profile and use our algorithmic models, our profiling engine, and our access to big data. We have access to roughly 100 million patient assessments. These assessments are actually in the post-acute care area. So if you think about a patient who's being discharged from the hospital and they say, your mom or dad's got to go to rehab for a couple of weeks, there is a requirement for an assessment that's done upon admission, 14 days, 28 days, and discharge. So you can imagine with 100 million assessments, we have the ability to go find this guy's twin, or I should say group of twins. So even though you see someone that's 75, has diabetes, and he's obese, we track about 15 other variables as well. So we're identifying how the patient's going to respond to a care setting or a treatment plan based on my individual characteristics. Very powerful for where we are in healthcare today. When you look at our roadmap, the beauty of the algorithm is it's generic in nature, so it can be applied across a lot of different areas. If you look at the bottom, we start with research. We've already done research work with nonprofits as well as the folks in Canada to actually demonstrate the power of the algorithm. We could focus on pharmaceuticals. We could go to the payers. I'm a healthcare guy of 30 years with small companies, and one thing I've got the scars on my back to show you is you've got to focus. So the reason we are focused right now on healthcare systems and accountable care organizations is because these are the guys that have the financial risk of patients once they leave the hospital. There's huge activity in this area. When you think about post-acute care, these are just some statistics that'll give you a sense for just how big this market is, which is, again, a microcosm of the big market. But in post-acute care today, again, these are skilled nursing facilities, nursing homes when patients leave the hospital. There's $63 billion spent annually. It's the fastest growing segment of spending in the US today. And if you think about it, it makes sense, right? We're trying to get patients out of the hospital faster. We're doing that, but we're sending patients out that are a lot sicker than they used to be. And we're pushing them into these environments. They're not, let's say the variance in care is dynamic. So when you think about avoidable readmissions, Medicare would say that you could save $17 billion if we could reduce the readmission rates. It's one of the reasons they're throwing all the money at it. The other component here is $10 billion that they talk about is matching the patient with the right care environment. So in other words, if Baruch has his hip replaced, he might need to go to a rehab facility for a couple of weeks. I had mine replaced in December of last year, and I went right home. So right now the government reimburses the same. Just doesn't make sense, right? So if we can identify where we're both going to maximize our recovery, we're going to save a tremendous amount of money. This is a huge differentiation for us as well when you think about the competitive landscape. Again, we build a profile from the ground up. This is a paid pilot that we have going on here in New York City with Montefiore Health System. You guys who live here probably know that this is one of the most prestigious health systems in the country. When you think about accountable care and shared risk, they are one of the most profitable ACOs in the country. And they do this by looking at patients across a continuum of care. So our initial interaction with these folks really was focused around